Hello friends, I'm Dr. Jeevram. Today I will discuss about the stroke and its management. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency and prompt treatment is crucial. Early action can reduce brain damage and other complications. If you or someone you are with may be having a stroke, pay particular attention to the time the symptoms begin. Some treatment options are most effective when given soon after a stroke begins. Signs and symptoms of stroke include trouble speaking and understanding what others are saying. You may experience confusion, slur your words, or have difficulty understanding speech. Paralysis or numbness of the face, arm, or leg. You may develop sudden numbness, weakness, or paralysis in your face, arm, or leg. This often affects just one side of your body. Try to raise both your arms or your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Problem seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Headache. A sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness may indicate that you are having a stroke. Trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or loss of coordination. When to see a doctor? Seek immediate medical attention. If you notice any signs or symptoms of a stroke, even if they seem to come and go or they disappear completely, think fast and do the following. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to rise? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? There are two main causes of stroke: a blocked artery, ischemic stroke, or leaking or bursting of a blood vessel, hemorrhagic stroke. Some people may have only a temporary disruption of blood flow to the brain, known as transient ischemic attack that doesn't cause lasting symptoms. Ischemic stroke. This is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow, ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through your bloodstream and lodge in the blood vessels in your brain. Hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in your brain leaks or ruptures. Brain hemorrhages can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke include uncontrolled high blood pressure or treatment with blood thinners, anticoagulants. Blockages at weak spots in your blood vessel walls, aneurysms, trauma such as a car accident, protein deposits in blood vessel walls that lead to weakness in the blood vessel wall, cerebral amyloid angiopathy, ischemic stroke leading to hemorrhage. A less common cause of bleeding in the brain is the rupture of an abnormal tangle of thin-walled blood vessels or the venous malformation. Transient ischemic attack. A transient ischemic attack, sometimes known as a mini-stroke, is a temporary period of symptoms similar to those you would have in a stroke. A transient ischemic attack doesn't cause permanent damage. They are caused by a temporary decrease in blood supply to part of your brain, which may last as little as 5 minutes. Like an ischemic stroke, a transient ischemic attack occurs when a clot or debris reduces or blocks blood flow to part of your nervous system. Seek emergency care even if you think you have had a transient ischemic attack because your symptoms got better. It's not possible to tell if you are having a stroke or transient ischemic attack based only on your symptoms. If you have had a transient ischemic attack, it means you may have a partially blocked or narrowed artery leading to your brain. Having a transient ischemic attack increases your risk of having a full-blown stroke later. Risk factors. Many factors can increase your stroke risk. Potentially treatable stroke risk factors include lifestyle risk factors, being overweight or obese, physical inactivity, heavy or binge drinking, use of illegal drugs such as cocaine and methamphetamine. Medical risk factors: high blood pressure, cigarette smoking or second-hand smoke exposure, high cholesterol, diabetes. Obstructive sleep apnea, cardiovascular disease including heart failure, heart defects, heart infection or abnormal heart rhythm such as atrial fibrillation, personal or family history of stroke, heart attack or transient ischemic attack. Other factors associated with a higher risk of stroke include age. People aged 55 or older have a higher risk of stroke than do younger people. Race. African Americans have a higher risk of stroke than do people of other races. Sex. Men have a higher risk of stroke than women. Women are usually older when they have strokes, and they are more likely to die of strokes than are men. Hormones. Use of birth control pills or hormone therapies that include estrogen increases risk. Complications. A stroke can sometimes cause temporary or permanent disability depending on how long the brain lacks blood flow and which part was affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of your body or lose control of certain muscles such as those on one side of your face or one arm. Difficulty talking or swallowing. A stroke might affect control of the muscles in your mouth and throat, making it difficult for you to talk clearly, swallow or eat. You also may have difficulty with language, including speaking or understanding speech, reading or writing. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Others may have difficulty thinking, reasoning, making judgments, and understanding concepts. Emotional problems. People who have had strokes may have more difficulty controlling their emotions, or they may develop depression. Pain, numbness, or other unusual sensations may occur in the parts of the body affected by a stroke. For example, if a stroke causes you to lose feeling in your left arm, you may develop an uncomfortable tingling sensation in that arm. Changes in behavior and self-care ability. People who have had strokes may become more withdrawn. They may need help with grooming and daily chores. Prevention. Knowing your stroke risk factors, following your doctor's recommendations, and adopting a healthy lifestyle are the best steps you can take to prevent a stroke. If you have had a stroke or a transient ischemic attack, these measures might help prevent another stroke. The follow-up care you receive in the hospital and afterward also may play a role. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include controlling high blood pressure, hypertension, lowering the amount of cholesterol and saturated fat in your diet, quitting tobacco use, managing diabetes, maintaining a healthy weight, eating a diet rich in fruits and vegetables, exercising regularly, drinking alcohol in moderation if at all, treating obstructive sleep apnea. Avoiding illegal drugs.